Good evening to all. I welcome you all to the exclusive Mental Health Talk Show, an initiative by Integrated Health and Wellbeing Council, powered by J.B Chemicals and Pharmaceuticals. I am Dr. Asavri Sawant, Public Health Specialist with IHW Council, and in this live session, we discuss the very important aspect of mental health and well-being, that is depression. World Health Organization estimates that mental health problems in India affect 2,443 per 100,000 population, out of which 21.1 out of the 100,000 population is seen to have committed suicide even. The economic loss due to mental health conditions in India alone is in between 2012 and 2030 is estimated to be 1.03 trillion US dollars. Hence, the aim of today's talk show is to impart expert guidance on various aspects of depression, for which we have with us Dr. Arjun Arya. Dr. Arya is Director and Consultant Psychiatrist at Arya Hospital, Neuropsychiatry and Trauma Center, Chandigarh, and has over 17 years of experience in treating patients with psychiatric disorders and addiction. Dr. Arya, we welcome you to the show, sir.
Thank you, Sabri, for a brief introduction. So may I start?
Yes, sir. Please go ahead.
Am I audible?
Yes, you're perfectly audible.
Yeah. Thanks, Asavri, for a very brief introduction on depression. Dear friends, I am a psychiatrist, as Asavri has told us, practicing for the last 15 to 20 years. And I'm privileged today to talk on the interesting topic of depression. Let me tell you, depression is one of the most difficult diagnoses in our psychiatry to make. Why? Because we not only follow the guidelines as we are taught in ICD-10 or DSM-5 or what we are learning by experience. It keeps changing. As you know, the science is changing, psychiatry is changing, and it changes from person to person. So to make a good diagnosis of depression, you need a very good clinical history, a good mental status examination, and an overall observation of your client for, say, about a week, 10 days to assess his mental health status and also understand his family dynamics as well as other parameters taking into account to assess depression. Now, when we see how do we recognize depression in a person, we always ask the client about a past history of depression, any history of substance abuse, or there has been an overwhelming anxiety which has been troubling the person. Certain people are shy in discussing their childhood anxiety or childhood traumas or separation or sibling rivalries, which have been ongoing for a long period of time. So they need patience, they need therapeutic alliance with the mental health expert to understand that wherein this overwhelming thing needs to be addressed and discussed at a certain point in life, right? So it is not always mandatory that a person with depression has a cause. It is just like some other physical illness like hypertension, diabetes, which is treatable with the help of medications and lifestyle modification exercises. So similarly, we can treat depression. Now, as Asavri said, that depression is a very common mental disorder. Globally, an estimation of 5% of adults, they suffer from depression. And more women are affected by depression than men. Now, why is it so? Why depression leads to suicide? And on an average, we have 7 lakh suicides in India per year, and it's globally it's increasing, and it's a major public concern. There is effective treatments for mild, moderate, and severe depression. Now, definitely, Asavri will make it more interesting by putting in some questions, and we can go in answering them and understanding what it is. So over to Asavri.
Thank you so much, sir, for explaining us that it is not just as simple as it sounds. So let us dive deep into it with explaining what actually clinical depression is and what does the person experience in it. What all can they experience?
Now, if you're asking me what does a person experience, it can all start with a poor attention span, a poor attention concentration, difficulties in carrying the activities of daily living, decrease in interest in pleasurable activities, a gradual change in behavior of a person. A person was cheerful, he was happy-go-lucky, and suddenly he becomes dull, pessimistic, and he's not able to open up. There is hopelessness or some ideas of guilt or sin which basically keep up in his mind. And also he has some recurrent thoughts of dying or attempting suicide. Apart from that, there are certain biological changes which take place in his sleep and appetite, right? They also get erratic with over a period of time. And, there are changes in appetite and weight. So some people have weight reduction and some become overweight, or they become lethargic. And also easy fatigability, of feeling very tired or low energy levels, decrease enthusiasm. So these are the common symptoms which we see mild depression. And of course, then, it ranges from sexual dysfunction in males and females, as well as early morning awakening. And definitely when it becomes more severe, then we have suicidal thoughts. So that is how the symptoms range from mild, moderate to severe.
So can you, sir, please also explain us how mild, moderate, and severe depression varies from each other? If any patient comes to you, how would you categorize him, or call him that he is suffering from clinical depression?
Now, look, whenever a person is experiencing a depressive episode, the depressed mood, which is seeing that feeling sad, irritable, agitated, should be pervasive, or there has to be an permanence which is there, and this should interfere in the activities of daily living. There is a gross marked dysfunction in social, occupational, and other activities of daily living that the person was doing when he was pre-morbid levels. So a person has difficulty in waking up, or he has difficulty in going to the office, and he has regular mood fluctuations. And it's not that it lasts for a day or so, but it has to be going on for, almost long periods of time, say 2 weeks. That is the criteria which we follow in ICD-10. And apart from that, the other accessory symptoms, like I told you, the poor concentration, poor ego, self-esteem, the self-confidence goes down, and he's always very emotional. I would say that he gets emotional on trivial issues which can be neglected, which can be ignored over a period of time. So all these changes are seen in the behavior, as well as other things in the activities of daily living, which become difficult for a person to cope up. His coping mechanisms go off. If he gets late for 15 minutes to his office, he feels that he cannot, he'll be fired, and he thinks of the maximum things happening to him. So these are the things which we see in mild. And when it becomes moderate, so it affects the other functions. The somatic syndrome comes in, the early morning awakening, and the psychomotor retardation, the decrease in sleep. He keeps on, thinking. There are recurrent thoughts which are coming to his mind. The anxiety goes in, and then we have something called as a severe depression. Now, in the severe depression, what we encounter is the suicidal ideas, the predominance of the suicidal ideas, or the mood does not change at all. The mood fluctuations become more deep, and he becomes numb. He does not understand what is happening. The general awareness about the world, the general knowledge about the world goes down, and he's engrossed in his own self. The self-care becomes poor, and that is how severe depression, then it requires treatment and other parameters to understand. So that is a basic difference between mild, moderate, and severe.
Thank you so much, sir, for explaining these things to us in such a nice, simple language for us to understand. So, as society is getting more and more aware about depression and these mental health disorders, such as anxiety and stress disorders that people are facing, and as depression is so much linked with your day to day life, how you feel, what your work environment is, etc. So, what are the different types, what are the different signs that society should be aware of so that they can identify and, encourage somebody who they feel around them is, having depressive symptoms? What should such society people advise to this person? Should they send them to a general practitioner or to a psychiatrist directly, or for some sort of checks? What should be the advice to normal people for this?
Look, first of all, it's a very pertinent question what you've asked. First and foremost is that one should not feel the stigma to visit a mental health professional. People do have stigma that they have to meet a psychiatrist or a psychologist. Well, if a person is having mild depression, or he's just having some mood swings, or he's feeling that there is a sudden change in his behavior, he must, consult a psychologist, because psychologists are the people who are, who can deal with depression more effectively than, other people, because sometimes we need a patient listening. By listening, by catharsis, by ventilation of our emotions, we are able to, feel better. We feel that, somebody is understanding us, or maybe, somebody is listening to us. And also, by virtue of, explaining what we feel like, coming from inside, the disturbed emotions, when they erupt, we feel naturally better. The anxiety goes down, the heart rate goes down, and the thoughts of, recurrent anxiety and overwhelming things go down. And that is, we relax. So just by, talking to someone, it can help. Talking to a mental health professional. So, like, we go to our office, we see our colleagues, they are upset over tribal issues. Somebody's had some conflicts at home, or somebody has some interpersonal problems. So we must guide them to, meet up with a psychologist. And our foremost priority should be not that to put the person on medication. The first and foremost priority should be addressing or having a psychological listening, or something called as a psychological evaluation. And based on the other assessments, if a person is unable to come out of this depression because of not being able to get help by a psychologist in the form of psychotherapy or counseling, then we need medications. And we should avoid this as far as possible in children who come out with behavioral problems. We have children who have childhood problems, like they have behavioral disorders, they have intellectual disability, they have autism, we have ADHD. We have markers to find out whether these children have these disorders or not. But then, yes, clinical depression in childhood is very common. There's so many school refusals who come to us, so many children who will not like to go to school because the home atmosphere is chaotic, or they are suffering from learning disability, and which is not diagnosed, and then they suffer from depression. So first and foremost is, as society member, without being a psychiatrist, if I see some behavior change in my colleague or a next person, even if it is a person who's working for us, we must advise him to speak to a psychologist. And the psychologist, if by virtue feels that the person's level of depression has risen up to a level which cannot heal by counseling, then he should refer the person to a psychiatrist. So this is how a mental health professional team works, right? Yeah.
Thank you so much, sir, for laying out the ground rules. I am sure this is a very necessary awareness that you spoke, that, if you are observing any sort of change in your colleagues or in your, teammates or anybody around you, please refer them to the psychologist, then psychiatrist, as per necessary. And it is so important to eliminate this taboo that people have, or Indian society in general has, around seeking help from a mental health professional. So can you also please touch upon different types of depressions that are temporary or are only occurring for certain phases in life, such as postpartum depression or any other situation based depression episodes that people should be aware of?
Look, we all have mild depression, or we all have, something that is mood dysregulation. Some people have something called a seasonal affective disorder. Now, this is a form of major depression which typically arises during the winter time, right? And it resolves during the spring and summer. And studies also suggest that seasonal affective disorder can be happening because of mediated by the changes in the circadian rhythms. It is more common in cold countries, right? So similarly, we have something called as vascular depression, which can take place. Person has hypertension, or he has cardiac problems, post-cardiac depression, or post-stroke depression. These are all self-limiting. A person has stroke, he's paralyzed, and because of this, he has depression. Or these days we have metabolic syndrome. There are certain people who have diabetes because of stress, and we give them antidepressant, their sugar levels drop normal. So similarly, we have post-oncology depression. A person has carcinoma, he develops depression. These are certain things which are temporary. They will come, they will go. So substance abuse induced depression. A person taking more alcohol is prone for depression. A person taking drugs is more prone for depression. So similarly, physical problems lead to depression. Stress leads to depression. So these are the common things which eventually lead to depression, which are present for a brief period of time. Some people need brief interventions, like I said, catharsis, and some would require medication. It depends upon person to person. We cannot say that, yes, this person has had a heart surgery. He was perfectly fine 3 days back. He's had a heart surgery. And because he is not able to work post-heart surgery, he has developed depression. And we need to give medication for it. So every individual is different. We need to assess and then give the treatment.
Thank you
so
so
these
much.
are the brief. Yeah.
So you were able to lay out many different kinds that are situation based, and people do suffer from depression from such situations. There is this burning question that I wanted to know, that is the season based depression that you shared, which is also called as SAD syndrome. When I was doing my master's in UK, I suffered from the same, and I was given vitamins and nutrients to supplement my diet. So can you please help us if fulfilling calcium and vitamin D helps in this? If not, what is the advised treatment for general depressions and also for seasonal affective depression?
Look, when you've talked about seasonal affective depression, yes, we do advise the person to get his thyroid levels, vitamin D levels, because they have a direct link. Normally do thyroid levels because hyperthyroidism is both associated with depression. So we need to delineate, we need to rule out these disorders such that we can treat depression. And we have alternative therapies now available for depression. Like we have seen now, yoga is effective for depression. In certain cases of mild depression, yoga is effective, or certain therapies like supportive psychotherapy or cognitive behavior therapy. Interpersonal therapy is effective for depression. We have vitamin E, which is, under study for effective for depression. We have certain fruits which are rich in serotonin, which is a neurotransmitter like serotonin, norepinephrine, dopamine, glutamate, brain-derived neurotropic factors. These are the neurotransmitters which are implicated. There are certain fruits like bananas, which are rich in serotonin and all these elements. So they have been suggested to clients to be taken. Similarly, if you see mild depression, as I said, it can be treated well with psychotherapy. We do not need medications. When we are talking about moderate depression, we can use certain drugs like selective serotonin reuptake inhibitors, selective serotonin non-epinephrine, and we have other basket of antidepressants which are available. Depending upon a patient's profile and his body weight, his BMI, we can start with a medication. We have now new antidepressants which take care of the sexual side effects, weight gain. What I would like to say is the metabolic side effects are less, and the discontinuation syndromes which were normally seen with a antidepressant like tricyclics, like imipramine and other drugs which were there, is very low now. So we have drugs available which have least side effect profile, least drug interactions. They are cost effective, and they are patient friendly, which can be given. And with the help of a psychiatrist, they can taper down the medications and continue psychotherapy for it. So these are the treatments available.
Thank you so much, sir, for clearing those queries. Also, can you please highlight the role of good lifestyle habits, the role of proper food intake and good exercise and going out in the sunshine to help prevent depression or cure depression? So are there any studies, or what would be your take on it?
Look, as I said, that depression is definitely a lifestyle disorder. So we do need to do activities, in the form of physical exercise. We should try to do activities which we like to enjoy. Like having a hobby is very important. We stay connected to our friends and family. It is not necessary that we need to stay connected through social media. We can meet them on a social platform. Then exercise regularly, even if it is a short walk or just a stroll. We should stick to regular eating, food habits, because sleep habits, incorporation of sleep hygiene is very important to stay away from depression. Avoid as well as cut down on alcohol. That is a must if we are taking. And we should not use any illicit drugs as far as possible, which can probably make our depression worse, I would say. We must talk to someone who can, we can share our feelings with. A close friend, or even if it's your spouse or somebody. And if these things don't work, then we must seek help from a healthcare provider. So these are the basic key points we need to keep in mind. Yeah.
Thank you so much, sir. So also wanted to know if there are any other diseases that have been seen to be leading to depression, or other diseases with which depression comes as a add-on disease. For example, any thyroid issues or hypertension, as you were pointing out.
Look, we have array of medical disorders which have depression. A person has hypertension, he has depression, diabetes definitely, and then I talked about post-stroke depression, post-cardiac problems, they have depression, and post-CA anxiety as well as depression is very, very common. Then hypothyroidism again, both disorders which are affected with post-menopausal syndrome in females, postpartum blues. These are two indications which have depression, which we see normally clinically in our outpatient department, which is very, very common. And premenstrual dysphoric disorder, PMDD, is also another medical disorder which is seen at the times of menstrual cycle. So these are the disorders. And then we have elderly geriatric depression, childhood depression I spoke on. We have certain depressions which arise because of the deficiencies of vitamin B12, vitamin D3, and low levels of calcium, malnutrition, iron deficiency, anemia. These all are the differential diagnosis of depression which we need to rule out. And also we need to rule out of excess alcohol, drugs, or any excessive use of benzodiazepines, which can mimic depression, which can lead to depression. So we need to rule out all these elements.
Thank you so much, sir, for clearing that. So in this very last segment, with few minutes left with us, let us take one by one the common myths that are going on around depression so that we can have your expert views on clearing those myths. So the first and most common myth that goes around in Indian families is depression isn't a real illness and it is just a temporary situation that you are in and you can always snap out of it.
Yes. So we must remember that we are not alone, and many people have experience that they've gone through, and they have found help, they have found people who are supportive, and treatment is available. Treatment is preventable. It's a lifestyle disorder. There are certain changes which we make. One should not have a myth that depression, we are going to a psychiatrist, we will never be able to get off or wean off the medication. This is the maximum stress which people have, and they ask me always when they come to my OPD that, look, you're going to put me on medication and it's not going to get weaned off. So it's not like that. Similarly, a person can control his diabetes and be off medication. It's like depression. But he needs to continue all the lifestyle exercises and other alternative therapies in consultation with the psychiatrist. Talk to someone who trusts you. It is very important. It is fundamentally important to share your feelings. We must talk to a doctor, health worker, right? Or a psychologist, a social worker, whosoever is in your vicinity, or a close friend who understands you, or a childhood friend. Develop hobbies like reading instead of active screen time, which I would like to mention. These days, we have children who are using more of mobile, which is predisposing them to develop childhood depression. So avoid screen time as far as possible, even it's on mobile or TV. Instead, we should meet and continue the old way of entertainment. And we must join a support group as well. These days, the libraries are not filled. We have more people watching Netflix and being on gadgets, isn't it? So these things are predisposing people for depression. Unhealthy lifestyle like junk food should be avoided as far as possible, and home cooked food should be taken. So these are the few lines which I recommend.
Thank you so much, sir. So many of the people who see a psychiatrist or psychologist and are advised lifestyle modifications and changes, such as meeting people, talking about everything, and are necessarily not put on antidepressants, have this ingrained notion that I am not given pills, which means I won't be cured of depression. So if antidepressants are not advised to me, my depression won't go anywhere. So what would you have to, say about this myth?
Look, this is again a myth, because just by going to a psychiatrist, it is not mandatory that you have to be given an antidepressant drug, or the antidepressant drug would work wonders and do lifestyle exercises for you. So just like, we have other diseases, we need a holistic program to understand. The first and the foremost thing which a doctor should do is to psychoeducate the person about his illness, and also explain him that he would benefit from talking to a psychologist, or get supportive psychotherapy. It is not mandatory. There are so many patients who come to me. I advise them that, why do you want to take medication? You start with psychotherapy. You practice sleep hygiene, which is very important. If you're having erratic meal plans, your food habits, and you exercise. With that also, our biorhythms and circadian rhythms in our brain and other symptoms come back to normal. They restore, just like a computer reboots, our body also reboots. So we can detox our body and reboot ourselves. So antidepressants do have role, but then there has to be a underlying justification for giving that. Just by giving an antidepressant will not make the person change. It will make him numb. The emotional numbing will take place and cognitive dulling will take place. So it is very essential for a good clinician to judge whether the person has that limit of psychomotor retardation that he needs medication. Based on his justification, clinical acumen, and other parameters, a person can give antidepressant.
Sir, another myth that is prevalent in the society that depression is a sign of weakness and that depression is rare and will not happen to me. And if I am feeling remotely sad or something, no, I'm not suffering from depression. It is just a phase because I'm not weak. So what would you have to say to, or your advice would be to individuals who feel this?
Ma'am, the basic thing is that whenever we feel low, by virtue of our mind and brain, we try to come out of this cocoon. If we are able to come out of this by, meeting a close friend or going to watch a movie or change in, place or a vacation or a small vacation, and we have come back to normal, then it's fine. We all experience this. But then if we are not able to come back to normal, then we need some help. So the bottom line is that, that if we are able to hit back at our work, professional, or at our duties at whatever, if a student is there, he is able to study back, or he is able to attend his colleges, which he should enjoy, or his school, and he is able to generate interest in his studies. Yes, momentarily we all feel sad because mood is constantly changing. We all need appreciation in life. We all need support. We all need love, care, affection. It is not humanly possible for everyone to give that at all point in time. So momentarily we all feel low. We try to come out of this by doing in whatever, we feel good at. But if we are able to come back to normal, that means we have, reached pre-morbid levels. But if we are not able to come back to normal, we consume more of alcohol, thinking that alcohol will help us, or, a permanent change in vacation will help us, then we are wrong. Then we need to seek professional help. Just like when we have, alarming blood pressure levels or alarming sugar levels. So that is how we make a society and self, education important.
Thank you so much, sir. We now come to the very end and on the very last question, which is your advice to all the viewers that are watching. So, sir, what would be your advice, one, for those who might be suffering from depression and are watching this show? What would be your advice for them? And two, for somebody who thinks his colleague or partner or friend might be going through depression, what would be your advice to the society people?
My advice is very simple, that we should first try to talk to a close friend, share our feelings. And yes, if the friend is able to help you, a childhood friend is able to help you, then we do not need a therapist. Or otherwise, we should book an appointment for a counseling session with a therapist. And if we feel that the therapist does not understand us, then we must seek the help of a psychiatrist. And we should take it very happily that we are meeting a psychiatrist. It is not that we can have a good open dialogue with him regarding the medication and the treatment options. It is not mandatory for a person to just put him on medication and treat him the way he wants. There has to be a justification and explanation of whatever medicine we are giving to a client. So as far as possible, what I understand depression is that we all must follow a strict lifestyle and develop hobbies as far as possible to allay depression. Avoid screen time and mobile, and also avoid less of other gadgets which are there in the surroundings, and try to do old activities which were there. a few decades back. Meet friends, socialize. They are important. They prevent you from depression. And having meals on time and spending time with family is equally important, right? So these are the buffer systems which prevent you from depression. Thank you.
Thank you so much. With that, we thank Dr. Arjun Arya for taking out time from his very busy schedule and sharing with us a wealth of knowledge and information with our viewers today. I hope the session was very enlightening for you, just as it was for me. So, thank you so much, sir. Um, Thank you, our partner, J.B Chemicals and Pharmaceuticals, for partnering with us on this very important talk show on depression and on mental health. Thank you. We would also like to thank all our viewers for staying with us till the very end. Thank you so much. With that, we thank you and we say goodbye. Thank you so much.